Who's looking for a great hamstring exercise that's going to help propel the way you walk, climb stairs, and move around on a daily basis? We've got a great exercise that's going to knock your socks off. All right. Oh, hey, I'm doing my stool walking right now. So this is our brand new exercise. I love it for knee rehab, but it's great for really retraining that medial hamstring, that semimembranosus. Very valuable muscle in keeping our hip, back, ankles, knees stronger. So here's the exercise. What we want to do is you find yourself a rolling stool or rolling chair. Ideally you find yourself a flat carpet. And what we're trying to do is I make it look a little bit easy because I try to do this once a day, more or less. But what we're trying to do is stool walk, and you're really trying to pull on these muscles here. Very low activity in the quads. As you know, that's a common theme in most of our knee and hip exercises. Low quads, lots of hamstrings right here. So these are working, and the basis of this is to just have these work all the time. So we can start with 2 legs. Sometimes it's a little tough to move. The friction of the carpet can be a little rough, especially if you've got those, high fibers or the loops. What we want to do here is you're gonna go ahead and just go forward and then find the length. Ideally, you can find yourself about 10 feet of length, and that's a great stool walking. Then what you do is you can alternate. Pull all the way through, try to get all the way through, and I'll show you on the side in a second. And then what you do is, if you really want to get good at this, it's one leg, and you're not deviating or taking the stool differently. So it's just like paddling with one oar. And if you're weak and you're using the wrong muscles, guess what? You're gonna pull the stool or the chair one direction. And my left knee after the ACL is just a tad bit weaker. I need to focus on that. So let's show you the side view right now. So once again, you're digging your heel up, your toes are pointed up, you're digging your heel down. If you have socks, generally you could use shoes as well, that's a little bit easier. But what we're trying to do is pull through. Really engage, pull through. And then when you push back, it's a little bit of a break to push back. It's kind of nice, but also very low quads, lots of hamstrings. So pull through, and you want to make sure you have good alignment as well. All right, so let's do the alternating one next. We're going to alternate, pull all the way through as much as possible. I gotta keep my butt on the stool, but pull all the way through, and when you push back, you can push back all the way extended, all the way extended, all the way extended. There it is again. You want to try to get the whole stroke. Good. All right. And then if you just want to do the one-legged, I'll show you on the left side. I'm going to try to hold on to the stool, but there you go. You really want to dig down, create as much friction, and that's going to help your hip, knee stabilizers, your little hamstrings here, and really work on that. Woo! So that's the exercise, stool walking. There you have it with this great little stool exercise. You can use rolling chair at home, but ideally you want to try to find some low-level carpet where you can try it on, or you can do it in place, just a little bit forward, a little bit backwards, doesn't hurt. But if you can get one continuous strip to walk through, go for it. Make sure you're firing that hamstring though that we mentioned in the video. So if you like what we're doing, please subscribe below, leave a like. Any comments, please email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin of Rehab and Revive. Remember, we can and we will get better together.